It is, on my clock, it's 3 o'clock, so we're going to get started. We appreciate you all taking the time to attend this. This press conference is on behalf of the Kalamazoo Health and Community Services Department. This broadcast is going to be available on the county website. My name is Jim Rutherford, and I'm the health officer with the Kalamazoo County Health and Community Services Department. To my right is Dr. Will Nettleton. He's a medical officer for both the Kalamazoo County Health Department as well as the Calhoun County Health Department. The young woman in the dark dress there is Bridget Rickenbaugh. She is the Deputy Health Officer with the Calhoun County Public Health Department. As you can see behind us and up to both screens is the aerial map identifying the proposed treatment area for treatment. This is impacting 12 counties in the state of Michigan, most of which are centralized in southwest Michigan. I'm going to talk a little bit about what Triple E is and give you some updates about where we're at in the state of Michigan. As of today, we have 8 human cases with 6 counties in Michigan, within 6 counties in Michigan, including Kalamazoo, Berrien, Barry, Cass, Calhoun, and Van Buren. 3 of these 8 cases resulted in death. Eastern Equine Encephalitis has been identified in 27 animals in 13 different counties. We have 14 horses, 11 deer, 2 wolf pups, and these are located in a variety of counties, including Barry, Berrien, Calhoun, Cass, Genesee, Jackson, Kalamazoo, Kent, Lapeer, Montcalm, Newaygo, St. Joe, and Van Buren. For more information, visit the state's arborvirus website at the Michigan Department of Health and Human Services at michigan.gov/EE. Why are we seeing Triple E cases in Michigan? Michigan has had outbreaks of Triple E about every decade since 1980, when the first human case was reported in the state. This year, however, the number of human cases of Triple E in Michigan are equal to the total number of cases in the last 10 years combined. It is unknown exactly why some years are more severe than others, although weather, including temperature and rainfall, is thought to play a role. What local authorities does and state public health utilize to support this response? Pursuant to the Public Health Code, including but not limited to MCL 333.221 and MCL 333.226, including 333.2433 and 333.2435, the Michigan Department of Health and Human Services and local health departments are both responsible for the protection of Michigan's public health. While local health departments generally take the lead on matters affecting their respective jurisdictions, Triple E has now been detected in over 12 counties in several regions throughout Michigan, and a statewide response to address this public health emergency is warranted. And now I'm going to have Dr. Nettleton talk a little bit about how Triple E impacts humans and other animals.
Thank you, Jim. We're here today because we care about the health of our communities. As a parent, as a family doctor, my heart goes out to the families of those who've been affected by that virus known as Eastern Equine Encephalitis. Oftentimes, we who work in public health make decisions that affect wide populations based on the best evidence that we have to make those decisions. And your local and state public health authorities have made the determination that the risk is ongoing for this rare but very serious virus known as Triple E. And that's why we're having this conversation we're having this afternoon. So first, Eastern Equine Encephalitis is a virus that is transmitted by a mosquito. It does not spread person to person or from animal to person. It can only be transmitted by that bite of a mosquito. Most people who become infected or exposed to Triple E do not become ill. However, there is a small percentage of people who may show symptoms such as nausea, vomiting, headache, or a fever. And then, an even smaller percentage of people may become really sick. That's that infection of the brain known as encephalitis. Symptoms of that include confusion, seizure, or even coma. And sometimes that leads to permanent brain damage or death. So again, to reiterate, that poses a real challenge, a rare disease that has been determined to be still circulating in our community that has that potential for a severe outcome of disability and death. Thus far, your local and state public health departments have recommended the following. 1, you can reduce your risk to exposure to mosquito bites and thus the virus by not being outside from dusk until dawn. You can further reduce your risk to that exposure by rescheduling elective outdoor events that are happening from dusk or dawn. Furthermore, we've already recommended to wear insect repellent, long sleeve shirts, long sleeve pants, to wear protective netting if you're sleeping outside, to have screens on your homes, and to remove standing water around your home as well. Local and state public health departments have determined that there is an additional step that we can take to further reduce our exposure to mosquitoes. And that's the reason why we're meeting today to discuss that intervention known as aerial spraying. Another way to reduce the population of adult mosquitoes that may be circulating in our community. Given the fact that these mosquitoes will likely still be circulating until that first hard frost. This is really another tool in the toolbox to reduce our risk to that, again, very rare, but sometimes very serious disease of Eastern Equine Encephalitis. Okay. So, some additional background, medical information about the background of EEE. There is no vaccine to prevent EEE in human beings. The treatment is supportive care. I have been in communication with several of our physicians who've been caring for our families who've been affected by EEE, and it indeed can be a devastating illness. And so the protective measures we've recommended thus far can be augmented by this recommended intervention, which is in partnership with the state of Michigan for aerial spraying. Okay. Good.
So, thank you, Dr. Nettleton. Given that information, upon strong recommendation from the State Public Health Department, we, again, in unison with 12 or 11 other local public health departments, most of which are concentrated in Southwest Michigan, have decided and are electing to have our community sprayed, portions of our community sprayed aerially. And I'm going to talk a little bit about what that looks like. So aerial spraying can quickly reduce the number of mosquitoes in a large geographical area, which can reduce the risk of exposure to the EEE virus. When conducted according to strict regulations, aerial spraying is safe for people, animals, and the environment. Aerial spraying has been successfully used in the United States for decades to reduce mosquito populations. How will the aerial insecticide spraying occur? Mosquito control professionals will apply approved insecticides as ultra-low volume ULV spray. They will be using twin-engine planes traveling at 175 miles per hour, 300 feet above the canopy. The ULV sprayers dispense very fine aerosol droplets. The droplets are smaller than the head of a pin. They drift through the air to kill the adult mosquitoes on contact. Where and when will the aerial spraying take place? Aerial spraying will take place in areas where there is a concentration of EEE cases in humans and animals. Application will begin after dusk at approximately 8 p.m. and will continue through the night or until weather conditions are no longer favorable for the application. Mosquito control is weather dependent. Wind speeds, temperature, and precipitation on the ground and in the air may affect spraying. To get updated application area information is available online at www.michigan.gov/EE. What will the spraying look like to me as a resident if I am outside when it occurs? Residents will likely not even notice the spraying when it occurs. Again, a twin-engine plane, 175 miles per hour, will do it above the canopy 300 feet in the air. They will be applying a very small amount of product in accordance with toxicological recommendations, approximately 1 tablespoon per acre, which is the size of a football field. Residents may not even see or hear the planes or feel the spray in the air when it's being applied. The insecticide that is being used is a product called Merus, M-E-R-U-S 3.0. It is an organic-based, EPA-registered botanical adult mosquito insecticide. It contains 5% pyrethins, which are naturally found in chrysanthemum flowers. Pyrethins are commonly used to control mosquitoes, fleas, flies, moth, ants, and many other pests. These products have been registered for use as insecticides since the 1950s. Merus 3.0 is an OMRI listed and can be used around organic crops and gardens. It may be used in certified organic production or food processing and handling according to the USDA National Organic Program regulations. OMRI certification available online at www.omri.org. And finally, will Merus 3.0 cause any adverse health effects in people? Merus 3.0 is registered with the EPA and is labeled for public health use over residential areas. In general, no short-term or long-term risk to human health are expected during or after spraying. EPA's evaluation of risk from aerial spraying of pyrethins is that the risk is very low for children and adults for breathing in levels in the air and for young children for hand-to-mouth activities from levels on surfaces. Ingredients in Merus 3.0 are classified as not likely to be human carcinogens. All other ingredients in Merus 3.0 have been approved for use as food components, and no fluorinated stabilizers or vitamin E's are used in this product. And I'm going to have Dr. Nettleton talk a little bit more about human exposure to the product.
So this idea of aerial spraying, and again, to reduce or eliminate the number of adult mosquitoes, is new for our community. You know, oftentimes in my medical practice, I describe procedures, medications, things that may seem routine to me or routine to my fellow medical professionals. But to my patients and to my community, this is new. This is foreign, and this is radical. And so I think it's reasonable and appropriate to have questions about this methodology and what potential risks and impacts it has on human health. And I think it's helpful to have perspective that there are other communities in the state of Michigan and other states who use this intervention as a routine practice. But it's important to acknowledge for our community is that we're digesting all this information on a very quick basis, on a very short-term time period. And I think it's important to acknowledge that fact. So with regards to respect to the decision making, the benefit to use this intervention, again, this aerial spraying, to reduce the number of adult mosquitoes that could be carrying that rare but serious infection known as AAA, has been determined to be outweigh any potential minimal risk that is associated with the use of the insecticide. And again, it is not expected. And in general, there is not human health risks to this application of the insecticide. And the exposure is, I think, what is important context to have. Again, this product is used through something called ultra-low volume. So a size of a pinprick needle that has this product goes through the air and on contact eliminates the mosquito. If a human being were to come into contact with that very tiny particle on your skin, in your mouth, in your eye, it will not cause an adverse health effect. It will not harm a human being. If folks choose to further reduce that very minimal risk, and again, not expected to cause human health effects, this is applied at night from dusk until dawn. Folks can further reduce that risk by being inside, by turning off your air conditioner, and by closing your windows if you further would like to reduce that risk. But again, even that direct exposure to skin, in your eye, in your mouth, isn't going to cause an adverse health effect. And it comes back to that exposure, ULV, ultra low volume. This isn't something that you see on TV or out in a more rural community that is a crop duster for an agricultural like pesticide. This is different. This is a different type of application that is employed by public health professionals in other communities in the state of Michigan and across the state, in other states across our country. Examples where it's been used in other public health emergencies include after Hurricane Isabel in the state of Mississippi. It's been used to reduce mosquito populations as well when Zika virus was a concern in other states. So this is a tool that public health professionals employ to reduce risk, again, of a rare and serious mosquito-borne infection known as trickle. It's also sometimes been used to reduce mosquito populations just in general, and also to reduce mosquito populations that are known to be carrying West Nile virus. So I wanted to share that context, because that's really important for our community to hear about the concerns they may have about this intervention known as aerial spraying.
So I'm going to finish up by just talking a little bit more about the product being used. There's been questions, and I'll just reiterate some of those. How long do these chemicals last in the environment? No special action needs to be taken in the morning after spraying. The active ingredients in the spray will break down over time. In air, the active ingredients break down within hours. In soil, the active ingredients break down within days. Direct sunlight speeds up the process of breakdown of the chemical. The day after spraying, no special actions are necessary, but if there are concern about contact with any leftover residual, you can rinse homegrown vegetables and fruits before cooking or eating, and wash outdoor surfaces or objects with detergent in water to remove any chemical residue. Next question is, what will the spray contaminate my drinking water source? The active ingredient in the spray binds strongly to soil, so chances are low that it could leach into groundwater. Drinking water reservoirs will be excluded from the spray area. The active ingredient in the spray also breaks down quickly in the surface water. Because of these factors, contamination of drinking water from surface water is also not expected. What if I think that I'm experiencing adverse reaction to the insecticide spraying? Anyone who believes they may be experiencing any health effects from insecticides, call their health care provider or the Michigan Poison Control Center at 1-800-222-1222. If symptoms are severe, call 911 for assistance. What should I do if I'm concerned about my pet or farm animals being outside during or after the spraying? In general, no health effects to pets or farm animals are expected from being outside when the spraying occurs. Again, if you are concerned, some ways to reduce exposure include keeping pets and farm animals indoors, shutting barn door and windows to meet minimum ventilation requirements during the hours spraying will occur. Pet and livestock owners should always work with their veterinarian regarding the overall health and wellness of their animals. And then finally, can Maris 3.0 harm pollinators such as bees? The application is not expected to have an impact on bees. Like most insecticides, Maris 3.0 could be harmful to bees if they come into direct contact. However, the insecticide application will occur later in the evening after dusk when bees are expected to be in their hives. The amount of chemical being sprayed is low and breaks down quickly. Concerned beekeepers can reduce exposure to their bees by covering their hives with a wet burlap. And then finally, what about the next days when my bees are active again? Any insecticide residual on foliage from spraying the night before should be dried by the next morning. Dry residue is not toxic to pollinators, including bees. I want to close on referencing the opt-out opportunity for residents. This is information that is found on the state's frequently asked questions, and this is also on our calcounty.com website, as well as our HCS Health and Community Service Facebook page. I'm going to take this excerpt out of their frequently asked questions because we've got questions relative to their ability to opt out. We are currently in a public health emergency, and aerial applications provide the most effective option to suppress the outbreaks by reducing mosquito populations. Due to the height and speed the plane will operate, it is not possible to stop the spraying over a single property. If an individual wishes to opt out of the application under the Michigan Department of Agricultural rules, an area of 1,000 feet by 1,000 feet would not be sprayed around the residence. This will reduce the overall treatment effectiveness in the area. Mosquito populations upwind of the opt-out area will not be reduced. The neighbors will not benefit from the reduction in mosquito numbers. Before exercising this option, please recall that EEE is highly deadly and that this aerial spraying does not carry any significant risk to human health. While it is unnecessary to do so, you can further reduce your exposure to EEE by staying indoors and closing windows and doors. If for whatever reason you would still prefer that spraying not occur in your area, you may send an email with your name and full residential address to eee@michigan.gov. The request to opt out of spraying must be received at least 48 hours before spraying begins. And finally, I encourage anyone that would like to get updated information or further information and more details to visit the information on EEE in Michigan, including the www.michigan.gov/EEE. For general health information related to EEE, it's recommended you visit www.cdc.gov/EEE. For more information on spraying in your county or in your respective area, updates will be provided via local media outlets, social media, and other channels 48 hours before spraying begins. For health-related questions, you can contact the State Health Department at 517-335-8165. So at this point in time, we're willing to take questions.
And before we do, Jim, I just want to reiterate that we in public health, we care about the health of our community. I live within the city of Kalamazoo. I know that this has caused a lot of angst thinking about EEE in general and the intervention to help reduce that risk. And I think it's just important to acknowledge those feelings and that we in the local public health department have a responsibility to make recommendations to protect the health of our community. And that's what we're doing today.
Go ahead.
What went into the decision to...
Can you step up to the microphone?
Yeah. What went into the decision to do this now as opposed to weeks before?
The opportunity to participate in this initiative was provided to us. We started having conversations with the state approximately 5 days ago. We have gone back and forth with the state for that length of time. There's been a lot of discussion with toxicologists, with epidemiologists, with physicians. Within the state health department, we've sought out experts within the entomology department at Michigan State University. I can assure you that the decision was and there was a lot of consideration that went into it.
Good afternoon. My name is Larry Schaefer. I'm the city manager of the city of Portage. First, I want to acknowledge Mr. Rutherford, the good doctor, Tracy Moore, and all the other public officials that have worked very hard on this issue. We're here to support you and to ascertain what we can do to assist you in your efforts. A couple of things that I'd ask you to pay particular attention to. The city of Portage is the home of the nation's largest pharmaceutical manufacturing facility, Pfizer. I had a chance to talk with the plant manager today, and we're hopeful that both the state and the county will be in touch with them to ensure that that facility is incubated against any possible contamination or any disruption in their operation as a result of this spraying. So the science is way above my head, so you guys, toxicologists, will have to figure that out. But both Pfizer and the pharmaceutical facility Zoetis should be consulted, and an understanding should be developed with them to ensure that there's no unfortunate combination that creates a perfect storm. The second issue is the city of Portage owns water tanks. The city of Kalamazoo does, and those water tanks are outfitted with large vents at the top that allows air to escape as the tank is being filled. Hopefully the state will start to, and the county will start to take a look at those owners of specific water tanks, and look at the techniques necessary to ensure that those tanks are timed in such a way as that the water is filling in the tanks, thereby pushing the air out of the tanks, thereby preventing any of the spray getting in those tanks. And other than that, I would only suggest that to the degree that you could make this information as universally available as possible to our public. So no information is as bad as bad information, and to the degree that you can be open to our public, we deeply appreciate it. And again, thank you very much for your service to our community.
Thank you, Larry. Appreciate your comments. In terms of your first question, we have been in communication with the pharmaceutical businesses in your respective community, and we are continuing those conversations to make sure that we're not missing anything. Secondly, we are the water supplies that you're referring to are municipal water supplies. Those are under the purview of the state Department of Environmental Quality, which is now EGLE. We continue to have conversations with that department as well as the state health department to assure that those water supplies are not going to be compromised. Any other questions?
In the state press release that was sent out today, it said that aerial spraying is scheduled to begin on Sunday night. Is that specifically is that scheduled to occur here in Kalamazoo County? Is that going to be one of the counties that sprayed first? And what is the notification process going forward to notify residents if there's changes in when they're going to spray, given that it's so weather dependent?
Thank you. The spraying, we have not been identified, or we have not been told by the state which counties will be first. We know that Kalamazoo is a priority county because we've had the most activity out of the 12 counties. We've had the most human and animal activity. So we will be, I think, at the front of the list. Planes will be departing out of either the Kalamazoo Airport or the Battle Creek Airport. We don't have any information yet as to what that schedule looks like. And there is, as I indicated earlier, the state website does have updates as it relates to when each respective community will be treated.
Hello, everyone at Spot 17. Secondary question to Kyle is actually, what should people be doing when those sprays happen? I was just out in Boston, and when the sprays were coming out, everyone ran to their windows, shut the windows down, no one was out on the street. So just go over a protocol. What should people do? Thanks.
So in general, there's no special action that needs to be taken to reduce an imminent health concern or hazard of that fine particle contacting human skin or being ingested. However, as you pointed out, there are further ways to reduce that risk and to provide that additional layer of reassurance. And that includes being inside, closing your windows, turning off your air conditioning. These, and also considering bringing your pets indoors and covering your swimming pool. Again, these are ways to reduce the exposure to that fine, ultra-low volume distribution of that insecticide. And, it sounds confusing, doesn't it? You hear the recommendation of there is not a human health risk or hazard associated with ultra-low volume. And then you hear me also saying, well, you can also do this. Well, I recognize that can sound confusing. And we in public health often speak in jargon in terms of exposure and outcome. And it all comes back to reducing that risk for potential exposure, whether it's reducing that risk to a mosquito bite, whether that's reducing that risk to exposure of an insecticide, or any other type of health-related event. And it's about weighing that decision about the risk associated with that rare but serious infection known as EEE that's transmitted by mosquitoes, and using this public health intervention that has been applied and administered in other communities in other states. And I recognize that, and it is a balance. So thank you for the question.
Any additional questions?
Good afternoon. Mike Quinn, District 10, Portage County Commission. Thank you for this presentation. I find it somewhat reassuring. What I would recommend in the future is that as soon as this sort of thing is being contemplated, that such a presentation be made as soon as possible rather than just now with a few hours to go before the deadline to opt out. Given that our experience in this country is that going from Agent Orange to Roundup with a lot of incidents in between, we've been told a number of times that certain compounds are safe to be exposed to, and later found out that they weren't. So I think the sooner you can present your evidence of safety, the more the residents will be reassured. The second point that I'd like to make is regarding the future here. We mentioned that we've had infestation and EEE occurrences since 1980. What plans do you have for something along the lines of integrated pest management to be carried out or experimented with in the future that would reduce the need for aerial sprayings? Thank you.
Thank you. In terms of the first comment, in terms of the information that's been provided, and just a reminder that much of the information that we're getting is since this afternoon. So we're doing the best that we can with the information that's being provided by the state health department. Our decision to participate took place this morning at 9 a.m. after I felt that I had the suitable amount of information to make an informed decision. And quite honestly, I did not have that information prior to 9 a.m. this morning. The second part of your question, in terms of where do we go from here, it is not my intention to recommend that we enter into a long-term program similar to what goes on in Midland County, Saginaw County, or Bay County on the east side of the state. However, I do think that we can do more in terms of mosquito surveillance. We know that in Kalamazoo County, we've got low wet areas, we've got bogs, we've got hardwood wetlands. So we are, historically, we have a history of a lot of mosquitoes within our respective community. So I think that it's important that we spend the time necessary and the resource to be able to do a better job of mosquito surveillance. We've done a minimal job because the funding from the state has been just that. So I would anticipate that at the state and potentially local level, there hopefully will be more resource to be able to enhance the surveillance work, to be able to know what we've got and utilize that information to make good decisions.
And to that question, this probably provides opportunity to look into what other communities do for a comprehensive vector control program. And that often has buy-in for communities over many months, years. And that's important to acknowledge. It's very different than the scenario we're in right now, when it's such time limited, and we act on the available information we have in consultation with public health expertise to protect the health of our community. Very different. I do think it offers opportunity to look into a comprehensive vector control program and to begin those conversations with our community, with our municipalities.
Thank you.
Good afternoon.
is Patricia Randall. I'm mayor of the city of Portage, and I just have a couple thoughts that I wanted to ask. I appreciate the information. I think information is the best way to deal with fear, and there hasn't been a good mechanism for us to really understand what is going on. I'm hearing from people, why now? Why not earlier in the year? This truly was a sense of emergency. Why are we doing it so close to fall when we are anticipating frost? I'm also hearing statistically with 250,000 people in our county, is this really something that rises to the level of an emergency? We have many other deaths, et cetera, to other causes that we might be able to control, but we don't have this type of reaction. I wonder if there is any consideration to a second spraying, or if there's any measurable way that we can see the effectiveness of the initial spray. So the germination period in humans is 4 to 10 days, so I guess I'm just throwing that out there. How do we know if someone's infected? How do we know if the spraying was effective? And to follow up on your previous comments, as a city with 4 lakes, a river, retention ponds, etc., with a lot of open bodies of water, we would welcome the education on how we go forward so that this situation doesn't continue to rise each and every year. We would be more than happy to sit down at the table and educate ourselves on how to control our environment so that we don't have to do something on areas that may not be as high a risk. Just my thoughts. Thank you.
Thank you.
So to that question about why now, it does come back to the conversations we've been having with the state of Michigan in our ongoing risk assessment. So that's point one. With regards to further conversations in our county, I think those would be well time spent in bringing in subject matter content experts and from other communities. The experience from other communities, I think, could be valuable insight. And oftentimes, coming back to the question about the number of cases, that's an excellent question. And that comes back to my previous statement about the challenge that is posed by public health professionals. And we have a rare disease, but we weigh that with the severe outcome. And that outcome is disability and death. And this is different because it's not a disease that goes between people that we're kind of used to hearing about. And this is different. This is from mosquitoes. It's vector-borne. And so we have our prevention measures, and then we have our intervention measures, which involve those type of spraying. So it's a different toolkit, and it does come back to that perception of risk. So I think it's important to acknowledge, and the context is also important to acknowledge. We in Kalamazoo County haven't had a case of Triple E since the year of 2010. So it's been almost a decade since we've had a case at all. And we've had 3 human cases in our county, and 1 resulting in death, and 1 pediatric patient, and we've had multiple animals. So this tells public health professionals, it tells veterinarians, it tells the folks who specialize in mosquitoes that this is highly unusual. This is something that the Kalamazoo in Southwest Michigan hasn't seen since the year 1980, this number of cases. So despite the fact that it's rare, it's weighed with that severe outcome. It goes into the risk assessment that the risk is ongoing until that first frost, that we have prevention measures that we've recommended to our community, and the state of Michigan has offered an additional tool in our toolkit to further reduce that risk and to protect the health of the public. That is essentially the decision making.
And I appreciate your thoughtful questions as well. And prior to making this decision, I thought about a lot of different things. And really, at the end of the day, if I got a public health initiative that has been proven to be safe for the environment, safe for human beings, that can minimize the potential for additional families going through what 3 families in our community have gone through, to have a death, to have 2 people that most likely will never be able to have fully functioning ability, it weighed very heavy on me. So I base that, and again, that's that risk to benefit consideration. I base that on the fact that I've got a tool, a public health acceptable tool to utilize that potentially could eliminate or reduce the likelihood of further exposure within our respective community. So that's why that decision was made.
How do we know the effectiveness of the spray?
Again, without a significant surveillance program, you're not going to be able to identify that. We'll continue with the surveillance that we do. It's going to tell us whether or not we still have mosquitoes in certain parts of the county, these particular cattail mosquitoes, and we'll continue with that activity. But I don't think we'll have the science to be able to identify the efficacy of the initiative. Historically, they've experienced about 85% effectiveness.
So we don't expect a second spray?
Pardon me?
We don't anticipate the need for a second spray?
We're not expecting that in Kalamazoo County.
And I would also refer further questions to Michigan Department of Health and Human Services, who will be providing that tool, and with the contractor who will be administrating that tool as the mosquito control professional. And I think they could provide, even in more detail, some of the answers to those questions.
Another question?
You mentioned a little bit about programs on the east side of the state, base, Saginaw, and the county has been well established for years. Do you know what is being done within Kalamazoo County? Are there any current fogging operations or trucks going on at a township level? Is that, are you aware of any programs that exist? I know it's not county-wide, but are there township level programs?
Yeah, there has been some activity that private organizations have undertaken. The Luke Bryan concert is a great example of that, where they treated 20 acres of farmland that is supposed to be used for tonight's Luke Bryan concert. Hopefully it dries up for that. In addition, I know that some schools have treated football fields, and that lends itself to part of the rationale for us doing this in a manner that we know that it's going to be done correctly. The application of pesticides at that level is licensed, and it needs to be done in unison with the Michigan Department of Agriculture. So we've worked, when we know that activity is being planned or potentially being undertaken, we direct those entities to the State Department of Ag.
Good afternoon, Meredith Place, County Commissioner representing the eastern and northern portions of Portage. I'm just curious if there's going to be a more detailed map provided to the citizens. Also curious if you can talk a little bit about the cost of the program. Lastly, we've been wondering if the state will provide any research citations on the particular insecticides' long-term health effects. Thanks.
In terms of cost of the program, we were told today that they anticipate treating 720,000 acres in southwest Michigan, and that is as far north as Montcalm County and as far south as you can see in St. Joseph, Cass counties, and it moves to the east in Jackson County as well. Again, 720,000 acres at an anticipated cost of approximately $1.8 million is the last number that I heard. In terms of long-term studies, I have not been made aware of that.
We get a more detailed map so residents can see down to.
Yes. Again, we just received this map from the state earlier today, so we'll be breaking that down for our respective jurisdiction, so that and that'll hopefully be on our website today or early tomorrow morning. Thank you. Any final questions?
Just state your name and titles for the
Sure.
record.
I'm Jim Rutherford, and I'm the health officer here with the Kalamazoo County Health and Community Services Department.
My name is Dr. William Nettleton. I serve as Medical Director for Kalamazoo County Health and Community Services Department, and also as Medical Director for Calhoun County Public Health Department.
And administratively representing Calhoun County is Bridget Rickenbaugh, the Deputy Health Officer with that department. We thank you all for attending, and we are available if you have any additional questions for us afterwards. Thank you.